On Hawaii News Now tonight, a Department of Health program to help paramedics in training has been canceled without notice. Our chief investigative reporter Lynn Kawano shows us why first responders fear it will put the public at risk.
Danny Cow has been a paramedic with AMR for 15 years. He was one of the first to take advantage of a State Department of Health grant that provided a $2,000 monthly stipend for EMTs to go to paramedic school at Kapiolani Community College on Oahu. KCC is the only approved paramedic training center in the state. That's why the neighbor islands have to fly their employees here, back and forth, for a year. But in July, without any warning, the Department of Health canceled the program.
It was a huge factor when I decided to go to paramedic school.
Dwight Fujimoto, a paramedic on Kauai, said the stipend allowed him to pay the bill.
We'd have to rent a place on Oahu, as well as still have to pay for our cost of living on Kauai as well.
And the cost of travel, the cost of lodging, the cost of meals. This will have an immediate effect. There was no even inkling that it was in peril.
The program started in 2007. In 2019, the health director signed an updated agreement that said the DOH is responsible for assuring an adequate workforce for emergency medical services. To do that, DOH is providing monthly stipends up to $2,000 to each of 10 emergency medical technicians, or EMTs, while they train to be paramedics.
We have one major hospital on Kauai, and sometimes the transport times could be over an hour. So during that time, having a paramedic on the ambulance allows us to be able to initiate certain treatments when it is extremely time sensitive.
Paramedics are able to intubate someone who cannot breathe, read the EKG, and push medicine into an IV.
We can dextrose for someone who's diabetic, right? Someone who's having a heart attack. But these are all the different tools that we have that we learn as a paramedic to use to help save somebody's life. As our population expands, people are getting older, our components are getting older. We need this care, and we need to make sure we can get this care to them immediately.
In the last 2 years, 16 paramedics received the DOH stipend to cover expenses, most from Maui. We reached out to the Department of Health for an explanation to why they ended the program without notice. We did not get an answer. At least one paramedic from a neighbor island is planning to withdraw without the stipend. I'm Lynn Kawano, Hawaii News Now.